Hello, I'm Dr. Lorenz, and welcome to my ongoing COVID-19 video updates. It's been a very sad and troubling week in our country for many reasons. Relevant to the COVID-19 pandemic are the protests and demonstrations which have brought together large groups of people in many cities, including Tucson. It appears that some of the protesters wore face masks and attempted 6-foot distancing, but those practices were not maintained in most of the protests, and especially at the more violent ones. Many public health officials are concerned about an explosive rise in COVID-19 cases in those cities. I would imagine that most of us were not present at those protests, but the problem arises when the protesters go to the same grocery stores, gas stations, gyms, or churches that we might. This means that we will see an increase in the movement of the new coronavirus through our community, and may have a greater chance of encountering the virus when we leave our homes to go to get groceries or gas. It means that those hygienic practices are as important as ever. And this week I'll review again those best practices, why they're important, and how they really do help keep us safe as possible. We'll discuss pulmonary droplets and aerosols, and the different ways they cause viral spread. I'll share information about face masks and the important features to consider when purchasing one. We've spoken previously about the new vocabulary words we've learned with this coronavirus pandemic, including personal protective equipment, flattening the curve, quarantine, and isolation. This week you might have heard the terms pulmonary droplets and aerosols, and how important it is to avoid contact with them to reduce your risk of coronavirus infection. Pulmonary droplet is the more frequently used and more general term. Aerosol is the term used when referring to the very tiniest of droplets. With any airflow through the respiratory tract, pulmonary droplets and aerosols are created and released into the air in front of our faces. Both droplets and aerosols can contain viral particles, and all size droplets and aerosols are released when breathing, speaking, coughing, or sneezing. The difference between pulmonary droplets and aerosols is their size and the behavior once they're released into the air. The infectivity of a pulmonary droplet is related to the number of droplets produced, their size, the concentration of viral particles contained in each droplet, and the frequency of the activity which is releasing the droplets. For example, a sneeze releases far more droplets of all sizes than a single breath, but breathing occurs far more frequently and so may be responsible for more droplet release overall. Droplets, by definition, are larger and relatively heavy, so drop to the ground or onto surfaces rather quickly after being released into the air. Most of them land on surfaces or the ground within 6 to 9 feet, depending on the velocity of release. Normal breathing would release droplets slowly, and they would land closest to the source. Speaking, yelling, singing, exercising, coughing, and sneezing result in progressively more powerful airflow, with further distances traveled by the droplets. Studies have measured droplets traveling 18 to 20 feet with an unprotected sneeze. Aerosols are smaller and much lighter than droplets. They can remain suspended in air for long periods of time and accumulate in poorly ventilated spaces. It is the aerosols which were responsible for that outbreak of coronavirus in the call center in South Korea, which I mentioned in a prior video. There was no significant physical interaction between the workers, but they were in a closed space for a prolonged period of time, and there was a 43.5% infection rate of the virus in that one room. Our nose and nasopharynx are our first line of defense in fighting infections. They catch all types of infectious particles, preventing them from creating infection in the bronchial tree and in the lungs. It is thought that the aerosols, because of their small size and ability to remain suspended in air, may be able to bypass the nose and the nasopharynx and create infection more efficiently, deeply in the lungs. It's the heavier droplets which are responsible for the contact spread of coronavirus, and the aerosols are responsible for most of the airborne transmission of the virus. This new coronavirus 2 is thought to utilize both contact and airborne methods of transmission. The importance of this information is to help explain why it is that all of the hygiene practices work together and are all important for reducing the spread of the coronavirus 2, especially as the mobility of our community increases. The 6-foot distancing is somewhat arbitrary. It works well if we are breathing or talking to someone, but less well if we are yelling or singing or breathing heavily during exercise. And the 6-foot distancing doesn't work at all with coughing or sneezing. One reason for choosing the 6-foot distance is that it's manageable in public places like the grocery store. Another reason is that with the social interaction of a setting like the grocery store, involving mostly breathing and talking at a normal volume, the concentration of droplets and viral particles is greatly reduced beyond 6 feet. So the 6-foot distancing can reduce both contact spread and airborne transmission of viral particles contained in the larger pulmonary droplets. Face masks reduce both droplets and aerosols from being released into the air, and this reduces both contact and airborne spread as well. Avoiding touching public surfaces, hand washing, hand sanitizers, and avoiding touching your face all reduce the movement of viral particles from you to surfaces and from possibly contaminated public surfaces to you, which reduces contact spread. The best way to manage the tiny aerosols which remain suspended in the air is ventilation. This is where meeting outside is helpful, or if inside, open windows and doors to increase airflow and air exchange. These are all intended for those of us who are asymptomatic, as remember, we can be infectious and not know it. If you're symptomatic, it's crucial that you stay at home, isolate yourself, and communicate with me so that we can evaluate your status and arrange testing if needed. Let's talk in more detail about face masks. They will be with us every time we leave our home for the foreseeable future and may play a role in mitigating viral transmission as we return to work. There are a multitude of masks advertised, and I think it's important to understand exactly what their purpose is and what the most important features would be when choosing one. The purpose of the face mask is first and foremost to prevent the release of viral particles into the air. There are 3 features to keep in mind when selecting a face mask: the fabric or fabrics, the fit, and the comfort. The University of Chicago did a great study to evaluate the efficacy of different fabrics, including cotton, silk, flannel, polyester, and chiffon. They found that a single layer of high thread count cotton, 600 threads per inch, was 65% effective in filtering particles less than 300 nanometers in diameter. The average diameter of the new coronavirus particle is 120 nanometers, so that's in that range. When this high thread count cotton was combined with 2 layers of silk, either natural or synthetic, the filtration efficiency increased to greater than 80% for particles less than 300 nanometers in diameter and greater than 90% for particles larger than 300 nanometers. The cotton seems to provide the mechanical filtration for the larger particles, and the silk provides electrostatic filtration of the smaller aerosols. This combination also has better breathability than some multi-layer fabric masks. Another combination that was equally as effective was 2 layers of 600 count cotton with a layer of fibrous cotton batting in between. And this fibrous cotton batting is often used by quilters. The fabric plays an important role in mask effectiveness, but more important is the fit and comfort of the mask. In the University of Chicago study, it was noted that a mask with gaps was less effective by a factor of 60%. It also is important to avoid any mask with a valve for exhalation. There's a lot of these masks on the market, and they are specifically for use in environments containing toxins or fine dusts that don't want to be inhaled but want to allow exhalation. The exhalation valve completely negates the effectiveness of the mask that we're needing here. Whether the mask uses ties or ear loops, it should fit snugly but comfortably against your face without gaps at the sides or below the chin. A nose clip or pinch can help fit and prevent eyeglass fogging. Put your mask on and take it off by handling the ties or the ear loops only. Avoid touching the front of the mask. The mask should be washable, and washing can be done in several ways. You can soak the mask in a Clorox solution of 4 teaspoons Clorox to 1 quart of water for 5 minutes. Rinse it well and air dry it to maintain the integrity of the mask. Or it can be put in a paper bag, set aside and not used for 2 days as well. I have one comment to make about the N95 respirators. I use them when I am testing patients who I'm concerned may have COVID-19, but I do not recommend using it during errands and interactions. A properly fitting N95 is not comfortable and can require some effort to breathe through. When it fits properly, it also is difficult to speak and be heard clearly. In the medical field, before we are allowed to use an N95 respirator, a medical history form is completed. And if there's any history of lung or heart dysfunction, a physical exam is required. Then the mask is fitted and tested with a hood over one's head and odors introduced to the hood to assure that the appropriate seal is created. In public, I often see people with the N95 just sitting on their nose, held in place with the nose clip and/or one elastic strap. There are notoriously gaps at the sides and below the chin. This is barely better than wearing nothing at all. Much more effective against the coronavirus too is a properly fitting cloth mask made from a combination of common fabrics. The calls and questions I've received indicate that most of you are working very hard to make the best decisions for yourselves and our community, and I commend you for that. We continue to be unclear about the path of this coronavirus pandemic in the United States and in Tucson. And with the opening of salons, gyms, and restaurants, and the unpredictability of the protesting, we're quite sure of a rise in cases, illness, and possible deaths from coronavirus. I encourage you to continue to be aware of your surroundings, to control your personal space as much as possible. Wear an effective face mask and continue the other hygiene practices when you enter public spaces. Thank you for continuing to care about this very important issue. And thank you for working with me to make the best possible decisions for the best possible outcomes for you, your family, your friends, and our community. I hope the points discussed today help you to feel more informed and better equipped to manage in these changing times. I care very much about each of you, and I want you to have a safe, healthy, and peaceful week ahead. Thank you. Bye-bye.